Welcome to the Camp Lejeune-New River Building Networks of Support training given by your Exceptional Family Member Program. Our learning objectives are to differentiate between formal and informal networks and identify the various ways to build your network. First, let's talk about circles of support. Here's an example. They're all of the different support networks that are in your system. In the example here, you see your local community, health providers, your Marine Corps family, friends, and your biological family. Let's do an activity. On a piece of paper, draw your own circles and list all of those who are your support systems. In addition to what you see listed, think about some of these. Are you a member of a group or club? Do you attend church? Do you work? Maybe you go to school. Or do your children go to school? Do you attend any classes? Pause this training and think of those in your circle. Feel free to add as many circles as you might need. A healthy support network is vital for everyone, not just military families, but especially for military families, and consist of both informal and formal networks. Informal networks are people who are part of your social network, like family members, friends, neighbors, coworkers, or members of a faith-based community you belong to. Formal networks are typically individuals from organizations or agencies that provide help or a service to your family, like EFMP and other Marine and Family Programs agencies. Think back to the activity we did. In your circle of support, did you have both informal and formal supports in your network? Formal supports are a given when you're enrolled in EFMP. But how do you build an informal support network? You can join a cause, get together with people working towards a common goal. You can volunteer at a clinic, at schools, community centers, with MCCS youth sports programs, and even your unit family readiness program. Join a class at the gym, community center, or even enroll in school. As we'll see in a little bit, MCCS has so many opportunities for enrichment and connecting to other military families. Get outside, go to the park, or take your children to playgroups. Walk around your neighborhood, mingle with other parents, caregivers, and families. And use Facebook or meetup.com to join local groups, or even start one of your own to meet those with common interests. Let's look at the MCCS Camp Lejeune-New River website. There are so many options. Take youth sport or adult sports, for instance. The page is a little slow to load, but here you'll see all of the different opportunities that are current and ongoing for sport and physical activity. The other option is to volunteer as an official. Next, let's look at outdoor adventures. There are always lots of opportunities to get out, expand your horizons, and engage with others in your local community. You can see here a listing on their calendar of all of the upcoming classes and activities to get involved in. The other option is with the on-base community centers. They put on different fun runs, as well as youth activities and classes. We can scroll down and see their calendar of events. Now let's look at fitness centers and group exercise classes. The MCCS group exercise classes are a great opportunity to get out and meet new people. You can see all of the offerings at different locations around base. And they're also inclusive. If you need any additional assistance in attending a class, you can reach out to them and let them know what your specific need might be. And last, let's look at some of Marine and Family programs. You can see Marine Corps Family Team Building has lots of additional opportunities for self-development and personal development, as well as working on skills like relationship building for both your spouse, your family, and community. You already have EFMP in your formal support network, but you can also reach out to current professional support such as early intervention providers, physicians, or even case managers. If you're not receiving appropriate services, request a referral from your physician to additional medical or mental health services to increase your formal support. Let's take a look at some examples of how networks can build upon each other. Take, for instance, following the MCCS Facebook page. You find a class or workshop to participate in, or attend a recreation activity. While there, you have the opportunity to meet with others that share common interests, and they have their own support networks that you then can share common interest with. Perhaps you start a local group based on what your interests are. You can spread the word on Facebook, at school, church, your kids' functions. You can organize a weekly meetup within that group to start to increase your informal network. Or even organize an activity or a meet and greet in your neighborhood. Can you think of some other ways you can build your social network? It's great to get out to these different activities, but to be able to engage with others can sometimes be a little bit of an uncomfortable situation. A good acronym to keep in mind is FORM: family, occupation, recreation, and message. It's an easy reminder for the different types of questions you can ask in getting to know someone and find something that you can connect on. Message is really important. It's what you want to leave them with and how you can plan to engage with them again in the future. Like saying, I really enjoyed talking with you. We should go get coffee or do X, Y, and Z activity sometime. Let's do another activity. Walk around the room and mingle. Spark conversation and remember that acronym FORM. What can you connect with someone else on? Pause this video. Wasn't that easy? Or did you find it difficult? Did conversation naturally flow? Did you eventually find something to connect on? Remember FORM when having small talk, either meeting somebody at the supermarket, at the gym, at church, or at your child's school. Your social wellness is a health priority. Much research now supports that our social wellness has concrete and significant impact on our emotional and physical health. You can read the whole article following the link below, but I'll share some of it with you here. Studies have started to link your social connectedness with measures as varied and dramatic as motor skill retention, cancer survival, general immune function, memory function, and overall longevity. On the flip side, social isolation has been connected with a higher risk for Alzheimer's disease and heart disease. Those of us with close relationships are probably more likely to receive encouragement to take better care of ourselves and seek out medical care when needed. But stress, they say, likely plays a significant role. Social relationships, particularly friendships, reduce stress and its chronic impact on our physical and mental health. Friendships in particular provide a key outlet for our emotions, a meaningful network of support, and in the case of old friendships, a unique mirror for our lives, the ups and downs, challenges, and achievements. Friendships can give us a fresh perspective and emotional space from our problems. They can also ground us to the trajectory of our experiences and other primary relationships. That's it for us. Do you have any questions, comments? Reach out to us. We've got our Camp Lejeune and New River offices. And you can always find us on Facebook and start to increase your informal social network through the EFMP Facebook page. Thanks so much for attending.